All right. Well, hello, everyone. I'm Ashlyn with Ochsner Digital Medicine. I am an event and content specialist. We are super excited to be here together on Valentine's Day, Day of Love. I hope everyone's having a great morning. This is going to be focused on the heart, so very fitting. As you can see, we have Reverend Anthony here. Just by his title, we can all tell he's a super busy guy within the Ochsner world. And then we have Aya, who's on our digital medicine team as well. So, Reverend Anthony, if you want to go ahead and get started, I'll be listening and we can get into it.
Wonderful. Good morning, everybody. Or good afternoon, excuse me. I would like to use my time today in more of a reflectional style. I invite you to reflect along with me. I'm going to speak about character and its effects on individuals and cultures through the practice of virtue. In times of great tragedy, we witness the quality of care and see the virtues of humanity and courage practiced, reflect on the positive response of the world community to the pain today in Turkey and Syria, the ongoing pain in Ukraine, and of course, always with us, COVID-19. The quality of character influences the fulfillment of our highest aims in life, such as found in our families, our community, in business, and even world politics. It is the quality of our character that increases meaning, connection, and well-being in life. The heart, the physical heart, is essential for human existence. Character is similarly essential in our human interactions for cooperation, peace, and coexistence. And so the presence of character is recognized when we help one another, when we care about one another, when we assist one another. And in healthcare especially, we hold the highest of ideals. And so the development of character in healthcare is so important. The Institute of Medicine, Education, and Spirituality 10 years ago suggested to the administration that we add a course on character development to the academic curriculum for medical students. It is now a required course. The title of the course is Character in Medicine, or for short, CIM. As the title suggests, there is a clear relationship between one's character and the virtuous practice of medicine in healthcare. Again, character development is not limited to healthcare. It is at the heart of all our interactions and personal development in all of society, indeed in all of societies throughout the world. So in the CIM course, the students enhance their character through reflection on and the practice of virtues. As part of their experience, they compose maxims, which are short statements that carry a truth about character. For example, one said, "Forgiveness heals all wounds and solves debilitating problems in life, but it takes time and great patience," end quote. Another student said, "Knowledge is of little value unless one puts it into perspective." which is a virtue, end quote. Still another said, you never know what you may find if you keep an open mind, which is the virtue of wisdom. Each one of these maxims is based on a virtue leading to the enhancement of character. So in this brief presentation, I will speak about the importance of character and virtue awareness. I suggest that the practice of virtues leads to enhanced character, which in turn leads to resilience in life and well-being. Two words we hear a lot about today. The famous philosopher Immanuel Kant was correct when he said, quote, "Science is organized knowledge. Wisdom is an organized life," end quote. And a student was correct in saying, quote, "Joy will come without effort to those who are beneficent, loving, and altruistic," end quote. Next slide. So words are at the heart of our heart, if you will. Words, like nature, half reveal and half conceal our soul within, said Alfred Lloyd Tennyson. Words flow out of what is in a person's heart, from Luke chapter 6. Words of gratitude are the keys to wellness and wholeness, said a medical student. Next slide. So, what are virtues? Virtues are words with a purpose. They reflect character in a person. So we use words to speak about the character of a person, even though we might not be thinking about that. Emerson said that, quote, "Character in nature is nature's highest form of expression," end quote. Viktor Frankl, that famous analyst who survived the camps of murder, said, "Everything can be taken but one thing: the ability to choose one's life and one's attitude in any set of circumstances, to choose one's own way." So words describe the inner habits of the heart. And today I'm going to teach you a few words about virtue words. You might want to use them in describing people from now on. It might change you a little bit. Virtues are the building blocks of character, resulting in perseverant resilience. It's amazing how virtue words can give us resilience, leading to the growth of others and ourselves. When practiced habitually, virtues can help all to face personal and professional challenges. Actually, virtues change culture. Well-being, or health of body and spirit, is the resultant of practice of virtues. Now, this has been shown over and over again. And in this brief presentation, I can't go into the research on this. Next slide. The second question we might want to ask ourselves is, what is this word character? What is it? We use it perhaps more than we might think, but it describes so much. So put succinctly, character is a complex constellation of characteristics that motivate and enable individuals to act as deliberate and moral people. Now that sentence is important. It's complex. It's a constellation of characteristics. It's not one characteristic, but they motivate us and enable us to act as deliberate and moral people. Character is a summation of a person's or a group's moral qualities seen in actions and behaviors. If we don't see them, we can't know them. And we hear them in words. That's why words that we use are important. Strong character and good judgment are fostered by character strengths such as fairness, honesty, kindness, leadership, integrity, trust, and teamwork. We've heard a lot about teamwork recently, especially about equity, which is justice. These and other words are not merely empty thoughts or intentions, but they lead to actions and behaviors which can be seen and felt. They are operational and effective. We know that leaders that are transactional, that is, looking just for a purpose, are not as effective as leaders that are transformational, that live what they say with the words they use. You no doubt have heard virtue words over the course of your lifetime. These are qualities of the heart which we know to describe good character, the possession and the expression of character. I'll emphasize that. Not only owning it, but expression of character has extensive benefits for the heart of all that we do and all that we are in life. We may or may not consciously name virtues like honesty, forgiveness, gratitude, curiosity, but we certainly know them when we see and experience them in others and in our institutions. On the other hand, we know when we do not see them. Ask a person on the way to the voting booth what qualities are desired in the candidate. There is no doubt today that in healthcare, virtues are essential to save and change lives. Character is a set of beliefs. You have to hold on to them. You have to acknowledge them. They have to be part of your attitude that define what sort of person you are. It is crucial that we are virtuous in our interactions with others. The resultant of the practice of virtues leads to good character, which in turn, and I'll emphasize this, leads to well-being on the mental, physical, and spiritual levels. So you see here the quote from Edmund Pellegrino, the probably the most famous virtue ethicist in medicine. And he says, medicine is a moral enterprise. And if you take away the ethical and moral dimensions, you end up with a practice based on technique. The reason it is a profession is that it is dedicated to something other than its own self-interest. Next slide. So a culture of character must be consciously built and adhered to for the good of all who serve and are served, especially in healthcare. You see here a variety of words, and they all fit into that category of virtues in one way or the other. Take a look. Look deeply. Are you familiar with any of these words? Do you call them your own? Look at the bottom, trustworthiness, patience. We all want to be known as honest and faithful. We look to our personality to have these traits which lead to what we call goodness or charity or ethics. Are you familiar with these words? Pick out a couple for yourself. Next slide. But the question is, are there universally recognized and researched virtues and character strengths that can build character and sustain well-being in life experience? Have people researched this area and come up with some strength of statements? How are they connected to our mission and values of work and life? I'm going to speak to these two questions in the next few slides. Remember that virtues are habits that we embrace. Some virtues like cooperation may be innate, but most are habits we learn and practice throughout life. We're taught them, we practice them, we mimic them. When we intentionally form virtuous habits, resulting in what we call character, we open ourselves to new opportunities and a truer version of ourselves. And so I asked you the question, go back to the other slide, please. Can you name some virtues that you live by and thrive by? So at Ochsner Health, we practice virtue by looking at our mission, our values. We don't use the word virtue, but I'm introducing it today for purposes of this discussion. Next slide, please. So you're going to see here a slide which I developed when working with nurses, training nurses 5 or 6 years ago. We called it the nurse residency program. And I introduced this word character in nursing with two people that have researched this area of virtues. Martin Seligman, the father of positive psychology, and Christopher Peterson, who did a lot of work on virtues over his lifetime. He recently passed away. They assembled a set of core virtues, researched it, and their accompanying character strengths that have been evidenced throughout time and place and are used now as the mark of speaking about virtues and character strengths. They arrived at 6 core virtues: courage, justice, humanity, temperance, transcendence, and wisdom. In this short talk, I'm not going to be able to go into even one in any depth. But remember that these have been associated, researched with health, resilience, with culture. Remember that virtues are motivators toward good actions. For example, an act of kindness, a character strength of humanity towards someone, relieves pain, brings a smile, brings rapport. Creativity can result in an idea that changes how people relate to one another in a troubled and conflicted department, in a department where people may not even be talking to one another. In their research, that is Seligman and Christopher Peterson, in their research, they showed genuine relationships between virtue formation and wellness, which have positive physical outcomes, including the curbing of burnout. So let me look at this slide with you. Complex. In the middle, and you can see that character moves through each one of these virtues and takes from each one to develop itself, to develop a character. So if we looked at humanity, we can see that humanity is a virtue that describes kindness, and the opposite, meanness or mean-spiritedness, or love, the opposite, selfishness, and social intelligence, the opposite, lack of self or other understanding. If one practices and behaves with humanity, one supports compassion, which happens to be one of our important values here at Ochsner. And if one really develops compassion, one supports healing, which is part of our mission. So one can say then that the practice of character through virtues can help us fulfill our mission on a corporate level. Now I can go through each one of these, but for time's sake, I will not. But transcendence, temperance, justice, wisdom and knowledge, and courage all affect our person in ourselves, in our own being, but also in a corporate or organizational structure, and also ultimately our patients. So if a medical student learns in his fourth year or her fourth year that humanity is an important thing, it is not merely something that they have to do, show compassion. They want to show compassion, and thus it helps in the reciprocal process of healing. Next slide. This is another way of looking at the same thing, only it is clearer. We heal with compassion, and that is developed by virtue, humanity. We serve with patience first, and that is developed by transcendence and temperance. We educate with excellence, and that is developed by wisdom. We innovate with integrity, and that is developed by courage. Do you get the idea? It's not the words in themselves, it's what the character that develops in the practice of those enlivened words. So building character for a person at Ochsner and the organization in healthcare in general, we practice a way of living. So let me take a few of these and explain them just a little bit. Courage is the maintenance of ethical integrity or authenticity. With courage, we become more aware of our integrity and our authenticity. And in fact, with the medical students, I use the word becoming authentic. With fairness in life, equity, equality, when making fair decisions, and decisions based on strength of justice, leadership and citizenship and teamwork are so important. And temperance is one that we all have somewhat of a difficulty with. It's the virtue of equilibrium or balance. It keeps us in balance. It counts us against excesses in any direction of our behavior. It supports prudence and humility. And a word that people don't really understand, transcendence. Viktor Frankl said, being human always points and is directed to something or someone other than oneself. Be it meaning to fulfill another human being or to encounter another human being. The more one forgets self by giving himself to a cause to serve, the more actualizes himself. Next slide. And this is something that I've been working now with for a while, trying to relate the word personality. We all know this word personality to virtues. So I offer this to you to think about. If we practice the virtue of temperance, we become more stable in our personality. If we practice the virtue of courage, we become more outgoing, extroverted to others, so that we become more helpful, even though we might usually be a pretty private person, introverted person. If we practice the virtue of wisdom, which is creativity and openness to others, we practice an openness to other human beings, their qualities, their goodness. If we practice humanity, we become more pro-social, more agreeable. If we practice justice, we become more conscientious about others. And if we practice transcendence, which is sometimes called spirituality, sometimes called meditation, sometimes called a sense of opening oneself to something higher, or gratitude, we become more serene. Next slide, please. Here are some outcomes of character development. Next slide. Oh, excuse me, go back to that slide, please. So the outcomes that we might look at are the issue of becoming more stable in life, being able to live with self and others in a more peaceful atmosphere. Next slide, please. Can you name your major character strengths and virtues and how they influence and guide your life and work? Hopefully, if you think about it a little bit, you'll think of one or two or 5 or 6 that are characteristic of yourself. Are you authentic or courageous at home and work? Do your thoughts and intentions mirror your words and your actions? And upon reflection, can you identify virtues found in your patients or your colleagues or your family members? I do an exercise with the med students called virtue marking, and that is they see an experience with a person and they say, oh, yeah, that's a virtue of a character strength of. It's amazing when you start reflecting. Next slide, please. So all of this has developed out of this program called IMESO. The possession of character in any profession or organization counts significantly. That's one of our beliefs. Character is associated with virtue attainment and practice for meaning and connection. It's another. The development of character is at the root of goodness and the qualities found in the organization and in each employee. And finally, goodness is the only investment which never fails. Quote from Henry David Thoreau. To learn more about IMESO and its programs, you can go to Ochsner.org IMESO. I hope in this half an hour or so, I hope you got some insight into the value of character and the practice of virtue in life and in work. It is at the heart of work and personal development. It is truly at the heart of the matter. Thanks a lot.
Thank you so much, Reverend Anthony. That was so good. We are now going to get into all about digital medicine. So Aya, if you want to take it away. And if anyone does have questions, please write in the chat and we can answer them. But Aya, it's all yours.
Thank you so much for that thoughtful presentation. That was wonderful. My name is Aya. I am one of the clinical pharmacists on the digital medicine team. Excited to be here today. And you may have heard of Ochsner's digital medicine program. So just to go over that with everybody. The digital medicine program really puts the power of their care into the patient's hands. And the goal is to help manage your chronic conditions, make it easy and convenient for you. And digital medicine currently provides care for hypertension, type 2 diabetes, and high cholesterol. Go to the next slide. Perfect. Within this digital medicine program, you will have a dedicated care team to help manage these chronic conditions. And I'll discuss the care team members more in a couple slides. You will be able to monitor your conditions remotely from anywhere while at home or even when you're on vacation. And yes, patients do this. The care that you receive is comprised of lifestyle and health coaching, as well as medication management when appropriate. Going into the way that the program works, so eligible patients will complete a consent form that is sent through MyChart. You will be able to select how you want your device, the blood pressure device or glucometer. It can be either mailed to your home or picked up at a nearby OBAR location. And once you take your first reading with your device, our team will be signaled then to enroll you into the program. And the enrollment process will be completed via phone with our team. We also have a dedicated tech support team that can help you set up your device or address any issues that come up during this process. The care team is comprised of a clinician, a health coach, and the support team for other digital medicine needs. The clinician is either a clinical pharmacist like myself or a physician assistant. And the clinician's primary role is to review readings with you, so blood pressure, glucose, cholesterol readings, and to determine if a medication adjustment is necessary. The clinician will take into account your history, your prior treatment, as well as medication affordability in order to develop an individualized treatment plan for you. The health coach on the care team is available to patients to discuss meaningful lifestyle improvements, provide support, as well as identify potential barriers to care. Health coaching can really empower patients to take charge of their health, and patients greatly enjoy this aspect of the program. Next, we'll go over some of our outcomes. So as you can see on this slide, on the graph on the left shows the outcomes for enrolled patients in the hypertension program in blue versus not enrolled receiving usual or standard care in yellow. After 6 months, about 80% of patients that are enrolled in digital medicine have achieved blood pressure control, as compared with 26% receiving standard care. Digital medicine patients also have improved medication adherence, which leads to a decrease in visits to the emergency room or hospital. Similarly, with the diabetes program, patients who are enrolled have improved glycemic control, with about 80% achieving their treatment goals at 6 months compared with standard care. This is especially important too when you consider that improvements in diabetes control can also decrease the risk for heart attack, stroke, and other diabetes-related conditions. As an Ochsner employee, you will also have access to additional perks if you're enrolled in digital medicine. Certain medications will have a $0 copay when filled at an Ochsner pharmacy. The devices, the blood pressure cuff, the glucometer, and diabetes testing supplies will be provided to you at no charge. And participants will also receive monthly Limeade points for program participation. And if you would like to learn more or get started, visit the newest My Ochsner app. Make sure you have the newest version downloaded and complete the consent questionnaire that's located in the My Records tab in the main menu. If you don't see it there, or if you have questions, you can visit this website, the ochsner.org/focus, to get started. And we would love to have you join our program.
Yep, we would. Thank you, Aya and Reverend Anthony. Both of those presentations were so amazing. We do have social media, so please follow us. Our next webinar will be May, so be on the lookout for that. We'll be posting about it. We'll have another great featured speaker, and I hope to see everyone there. If you have questions, please go to ochsner.org/hearthealth. I think we have a question. I'm currently enrolled. Do I need to do anything? No, you don't. If you're enrolled and you're active in the program, you should be good to go. Definitely speak with your care team and see if they need anything from you. And then someone asked if they joined last year, do they have to re-enroll this year? And correct me if I'm wrong, Aya, but I think you do not need to re-enroll every year. Your membership will continue over. But
Correct.
Thank you everyone so much for joining. I hope to see more of you in the future. Also be on the lookout for an email from us. We actually will send out a recording and a little bit more information about digital medicine. But if y'all have anything else you would like to say, I think we can go ahead and end it. Again, happy Valentine's Day, happy Heart Month, happy Black History Month, and I hope everyone is having a great week. Thanks, everyone.